Hello, myself Dr. Samiksha. I am a homeopathic psychiatrist and the counselor. Today we talk about the PTSD, the post-traumatic stress disorder in children. In the previous video, we talked about the PTSD about in the adult, its sign and symptoms, and the treatment part. So what is PTSD in children? So PTSD is a mental health condition which can be triggered by the terrifying event. Either you are experiencing it or either you are witnessing it. And it's very common in children. In India also, it's very common. What are the different traumatic events you can see in the children? Like the bullying at the school, bullying by a teacher, the abusive parents or the fight between the parents, the child abuse, neglect, his health condition, the death of the loved ones, and the separation of the parents, or the environmental factor, for example, war. These all are the traumatic event for a child. The child may experience this event, may witness it, or may learn from a close family members or the friend. For example, if the parents are getting separated, parents think that they will not share with the child right now, or they will share it later. But if the child get to know by some relatives or some family members, they may experience the PTSD symptoms. They may experience repeated or the extreme exposure to aversion detail of the event. If the symptoms get worse, which can be last for a month or even the years, and if it interfere with the child development or if they interfere with the day-to-day activity, your child may be suffering from the PTSD. So you should learn what are the different signs and the symptoms of the PTSD, because PTSD not only affect at one level, but it can affect at the developmental level of the children, at the emotional level, at the physical level, and at the social level. Many children suffer from the traumatic event. It can develop later or in their life, the hyperactiveness, the depressive, anxiety symptoms, and even the change or the shift of the personality, and later on develop into the personality disorder. So you should focus on the child if the child is suffering from the PTSD. So how we'll get to know if the child is suffering from the PTSD or the stress or the depression? The most common the PTSD symptoms in the children is the nightmare, bedwetting. You may realize or you may get to know that child is getting nightmares. He gets easily waked up at night, or the crying at night, not able to sleep properly, increase irritability, withdrawal from a friends and his activity. Like if the child previously loves painting, but if he get to know about his parents' divorce condition, he doesn't like painting. He doesn't want to play with anyone. Persistent into the negative state. He was cheerful initially, but now he's not. He's also having a difficulty in school or difficulty in concentration. His grades are decreasing. You can see there is a constant pain in his body. There is numbness. The destructive pattern, destructive behavior is also very common in case of the PTSD children. Children may re-experience the traumatic event in a various way, such as the flashbacks and memories, the behavioral problem, detachment through the play. Like I remember I have one patient, like parents brought this child to me, and they are saying that his behavior is getting weird day by day. Don't know what is happening with him. He doesn't want to go to the school. Initially, he likes school, he likes drawing, he likes football, but now he does not want to play anything. He even talk very lazy at home, not playing with the society friends also. So when I asked him, he doesn't say anything. He just start crying. So after the taking detailed information, get to know that he's getting bullied at a school. So whenever school name comes up in his mind, or whenever anyone talk about the school, he get that flashbacks. And he has a tremendous fear of the school because of that bullying. And he did not share this with his parents because he thought that parents will also blame him or parents will scold him. So that fear and the fright, it since more than the 1 month or the 2 month, he's getting that flashback. Is he went to the school, but he come back, or he's getting that nightmares. This is the PTSD. He may avoid thinking of the trauma. The child may avoid talking of the trauma, get easily frightened, the constant negative mood, low mood, negative thinking, always on a guard. If someone say anything, he may get backfire or he may get shout. Avoid places like school, avoid activity, flashback, cannot concentrate, aggressive behavior. Even the if you think about the PTSD, to avoid the places, if the person's like swimming, but by any chance he drawn in a swimming pool, he may get that fear of that place. But if that fear continue more than the 1 or the 2 months, then we can diagnose at a PTSD. So how we diagnose the PTSD in children cases? So according to the DSM-5 criteria, we diagnose the PTSD in children. So if the child directly experiencing the traumatic event or witnessing the event or learning the event, he having that recurrent memories, distressing dream, dissociative reaction, marked distress, he avoid that situation, there is continuous negative emotion, social withdrawal, like बच्चों के साथ खेलना नहीं है या कंटिन्यूअसली नेगेटिव मूड में रहना है या जो भी एक्टिविटी एंजॉय करता था पहले अभी नहीं कर रहा है देयर इज एग्जैगरेटेड स्टार्टल एट नाइट स्टार्टल मीन्स कभी भी नींद से एकदम से उठ रहा है रो रहा है बीच में ही concentration problem sleep disturbances and clinically significant distress and impairment in the relationship with the parents also sibling also peer also. So we can diagnose these as a PTSD. But it's very important the duration of the disturbances if it's more than the 1 month. So how you can manage that? There are the various way you can manage that, but homeopathy works best in case of the PTSD. But the initial goal of the treatment for child, it's to provide a safe environment, reassurance and the emotional support, most importantly from the family member. The psychological therapy with the medication, it's very important because it helps the child to gain a sense of safety and it addresses the multiple level like emotional level, social level, and they can overcome the behavioral problem. There are the numerous remedy for the homeopathy, but the most common, the ignatia. Ignatia is indicated when the child having that flashback from the past incidents. There is constant sadness, depressive feeling, weeping spell, desire to be alone, or aversion to talk. The child may feel angry about himself. There is constant anxiety. And the PTSD, it's most important that follow the unexpected death of the loved ones. The natromu remedy is a great help in case of the depression, like the PTSD. Those needing it frequently to recall the trauma, sad all the time along with the weeping spell, the child isolate themselves after the traumatic event. They avoid going to the school or going to the outside, get easily irritable. Califos is helpful in managing the various issues, like in case of the, for example, the sleeplessness or the nightmares. Staphylococcus aureus is also very good remedy in a children where child would develop the PTSD after some sexual or the physical abuse. It acts well when the person keep dwelling on the past unpleasant experiences, and it occurred when the spells of anger, the anger outburst. There are the various therapy which can be helpful. So one is the CBT therapy, which can be focused on the trauma focused CBT, the DBT therapy, and the relaxation therapy. For example, biofeedback, yoga, deep relaxation, self-hypnosis, meditation, and the play therapy, where the child may overcome with that fear, and it helps in his emotional level, it helps in his developmental level and the emotional stability. I hope this helped. Thank you.